Now, when you pick the product up from the pharmacy, you'll have a package with 2 prepackaged syringes. You're also going to have an instruction sheet which actually tells you the steps, and your doctor or nurse can write down information of when to give it. It also will give you pictures on how to give it. These can also be found right at the website for Diastat, and we have copies also on epilepsy.com. So a few things to point out: that the pharmacist needs to set the dose for each syringe. And so you'll see a little window here where the dose is kind of what we call dialed in or prescribed, and that can be done only by the pharmacist. So when you pick it up, you check with your prescription, what your doctor told you, you check the window, make sure that it's the right dose. You also want to look and see, is there a color-coded a bar here, in this case it's a green bar, that says ready. If you don't see that, you take it back to your pharmacy to make sure that the dose, the syringe, is okay to use. Also, you keep in mind that this is a one-time use medication, and you would follow the instructions on the packages of when and how to dispose it after you've used. So let's say this is Susan's come across her child who's having a seizure. And so she's going to demonstrate for us what she would do in giving the medication.
Okay, I would have checked this already, so I see the green bar. I would have my child on their side, and in this case it would be easier if they're facing me. This is a little stiffer than my child. And holding the Diastat, I check the dose, I see the green bar, I'm good to go. I remove the cap, making sure the safety pin is in the middle and has come out smoothly with it. I would rip open the lubrication pack that's also included with the medication. I would dip the tip in the pack, get a lot of lubricant on it. I would just pull the pants down enough just so that I have access to the anus, and then insert the medication very slowly. Press the plunger with a count of 1, 2, 3. Hold the medication there for a slow count of 1, 2, 3. Remove the syringe, holding the buttocks closed. 1, 2, 3. And then pull the clothes back into place.
Okay, so it's as simple as doing that.
It is simple.
Right?
It is simple.
And as I watched that, you kept the person's privacy pretty well.
Absolutely.
If the person's in a chair, can you do that as well?
I would remove them from the chair and bring them onto the floor to do that. Again, turning them on their side towards me so that I could manipulate them.
Okay. So a person that's having a seizure, you certainly can do it by yourself if the person's not too large. If it's a larger person, you could easily call for help for someone to
Absolutely
help you with that.
And we've also used people as barricades, asking the onlookers to just turn their backs and be a wall around us. We've also used that strategy as well. It gives them something to do. You know, particularly in a school setting, if you ask the adults in the room to just be a wall. It depends. It depends on the situation you're in. Certainly at home, but it can be done by one person, and if you have someone to help you, certainly use them. Use them as necessary, whether it's for privacy reasons or to help you, because obviously this is a still doll. If it's someone convulsing, you may want them to help you hold them on their side while you manipulate the syringe and remove the clothing. But you don't have to remove it completely, as you saw.
So when you use this rectal diazepam gel or Diastat, because it is available in generic or in the brand, it's as easy as doing that. And then you're going to follow your typical monitoring the person after the seizure. You're going to continue to watch and see if the seizure's subsiding. If the seizure's not subsiding over the period of time that your doctor or nurse has recommended, you give the second dose if that's prescribed. As the seizure is ending, you then let the person rest. But as we talked about before, you follow the steps in watching someone during the recovery period. If you're at home, you follow the steps of what you've decided upon with your team about how to monitor your child. People can go back to their day-to-day activity many times. Sometimes people are sleepy and might need to have a nap. if you're doing this with a child, they should talk to their school nurse to find out if there's any special policies. And sometimes, depending upon where you are, they might require that you call 911 or call for emergency help as backup. It's not necessary unless the rectal diazepam gel doesn't work or the person has continued seizures.